I'm going to talk to you today about what you can do for your low back pain if the things that I've not already talked about, the exercises, the stretching, the strengthening, the walking, haven't been effective. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. So let's dive in. The first thing, let's talk about what traditional medicine has to offer. Traditional medicine typically treats you with medications. Medications come with their own risks of addiction, such as narcotic addiction. Medications such as ibuprofen come with their own risk of kidney disease and ulceration of your stomach or intestinal lining. So they're fraught with some risks if they're taken on a long-term basis. I did practice traditional pain medicine, so I'm well aware of the risks and the downfalls of these treatments. I used to do steroid injections to help people on a short-term basis. We would inject under X-ray guidance with steroids, whether that be epidural injections for nerve pain or facet joint injections for joint pain or sacroiliac joint injections. These were all injections with steroid. And what I found was that on the short-term basis, some of these injections were effective. On a long-term basis, typically these injections were ineffective. We at Regenexx Pittsburgh and I switched to doing regenerative treatment with your blood platelets in something called platelet lysate, which is a PRP derivative that's great for nerves. We switched many years ago and have not looked back. We treat the spine, we treat the ligaments, we treat the joints, we treat the nerves, and we can even treat the discs to help you get better. And again, we don't just stick one needle in, we treat comprehensively. This is all done under X-ray guidance with a fluoroscope or ultrasound and X-ray guidance, where the needle is specifically guided into the area of injury or pathology so that we can help get you better on a long-term basis. So whereas with steroid injections, we typically would help people for 6 to 8 weeks maximally. With the regenerative injections, we're typically helping people for years and really making a difference in their life, because when you stabilize a spinal segment, treat the nerves, treat the discs, etc., you are literally getting people better and they can function at a much higher level, get back to the things that they love, get off their narcotics. And what we find is they're extremely thankful for the work that we've done. It's using you. Platelet-rich plasma comes from platelets within your bloodstream, which we take out and concentrate to provide a dose-specific benefit to the areas we're treating. So all patients are not the same, and therefore the treatments that we provide to patients are customized based upon your specific need. The analogy, and talked about this before, we have these blood platelets and bone marrow concentrate containing stem cells within us. Because they're not concentrated, they can be slightly helpful. It's like the wind blowing through your hair as opposed to a wind turbine generating electricity for a city or a field of solar panels. You feel the sunlight in your face, but when you harness the sun's energy, again, you can create electricity for a city. The same is true with your platelets and your bone marrow concentrate containing your stem cells. These are healing factors that, when concentrated and used correctly and effectively, can make a huge difference in your back pain. As such, we find that the amount of spine surgery that's really necessary is very, very small and very seldomly indicated. The spinal surgeries that are out there range from simple microdiscectomies, where a portion of your disc is removed, to removing a portion of your lamina, the bone in the back, to give your spinal canal more space, in the case of a spinal stenotic, to very involved spinal fusions. Spinal fusions are sometimes necessary. Some of this surgery is sometimes necessary, but it's far less necessary than surgeons want you to believe. Spinal fusion surgery, unfortunately, is a surgery that fuses together spinal segments that are designed to be mobile. And when you do that, the spinal segments above and below the fusion often break down and fail prematurely because the demands on them are much greater. These are surgeries that are fraught with problems and should be an absolute last resort. Therefore, the treatment of regenerative spine care using your blood platelets primarily, about 99% of the time, we use platelet-rich plasma for spinal care. It really can make a huge difference on a long-term basis and get you back to life's enjoyments. So if your doctor has contacted you and has recommended traditional treatment with steroids or spinal surgery, which is fairly extreme, my recommendation would be to get a second opinion at Regenexx Pittsburgh. We'll talk about your spinal condition and what we can do in a regenerative way to help you. Please understand that the consults that we do, we spend a great deal of time with you, probably on the order of 45 minutes to an hour, going over your exam, gathering your history, looking at your diagnostic studies, and formulating a treatment plan for you. And generally, most of the time, it's going to make a huge difference in your life.